Good evening, everyone. So I'll be presenting a case about pediatric retinitis. This is a 3-year-old male who presented to our clinic with decreased vision in both eyes since 6 weeks. Initially, it was associated with severe eye pain. He don't have any history of fever or infection. So he's a known case of severe combined immunodeficiency on regular IV immunoglobulin. He was taking it every 3 weeks. And he had a mild developmental delay. So regarding the family history, he's having brothers who had also SCID with poor vision. So on examination, his visual acuity in the right eye, he had some fixation with very limited following. In the left eye, he had no fixation at all. He had also a yellow reflex. On fundus examination, we can notice that there is a hazy view in both eyes. There is a whitish optic disc edema. There is perivascular sheathing, hemorrhages, exudates, and tortuous blood vessels. So we diagnosed him with retinitis, and CMV retinitis was on top of our list. So he was admitted under general pediatric. Infectious disease were involved. We did AC-TAB, then started him an IV ganciclovir. Blood tests were done, including infectious blood test. Anterior chamber tab also was done. So after 5 days, subjectively, he was doing well. Vision-wise and card, his right eye had 1 logmar, and left eye, he had still wandering eye movement. OCT here shows that he have vitritis, vitreous detachment, increased thickening, retinal thickening, and subretinal fluid. So all investigations came back negative. Infectious team wanted to pull out the IV ganciclovir as all tests were negative, but we insisted that this is a presumed CMV retinitis and the patient was improving and we need to continue on the treatment. After 2 weeks of the treatment, his vision improved to 0.9 logmar in the right eye and 1.2 logmar in the left eye. So in summary, this is a 3-year-old male with SCID. On treatment, he presented to us with 6 weeks decreased vision in both eyes. On examination, he had retinitis, AC-TAB was done, blood tests were done also, and we started him an IV ganciclovir. But all investigation came back negative, so it was a presumed CMV retinitis. So in this case, is it CMV retinitis? Could it be something else? Shall we do vitreous tab here despite the clinical improvement? Thank you.
Thank you, Ishfaq. So I'm going to ask you this question because I was probably partly involved in this case. So the dilemma here, the infectious disease, they say that it's all negative. You want to pull off your IV ganciclovir, but the patient is clinically improving, but we don't have any diagnostic labs to support our diagnosis.
Well, clinically, this looks like a CMV retinitis. I've no doubt it is. And the fact that it's improving, I don't think you should do any vitreous biopsy. I think it will complicate matters. Although I think the prognosis for vision is very poor here.
I mean, I would have thought doing a vitreous tap would be negative now anyway. He's had all that IV ganciclovir, particularly if your AC tap already was negative, so I agree.
And I mean, in these situations is it better to do an AC tap or a vitreous tap or both? Would be a vitreous tap cause more problems as compared to an AC? What would be the preferred thing?
I probably would have tried to do both, but it can be very difficult in a young child because the vitreous is so solid, so sometimes
I think I do a vitreous tap, but I think you've got to be careful doing a vitreous tap. I'd get a retinal surgeon to do it rather than sticking a needle in and hoping for the best.
Yeah, they can be very difficult because it's such a solid vitreous.
And as a child with a fixed vitreous.
Okay, well, the patient is still on the treatment and he's improving. He's on a 14, I think, a couple of week course of oral.
Where do you think is the source of his CMV?
Well, the patient is SCID, so he has severely immunocompromised.
All right. Okay.
He has that, so I think he has. I think probably in the past it was positive.
Yeah.
He had IgG positive, but there's no active source as yet.
Yeah.
Yeah. Okay. Great.